The Honorable Committee of the 14th International Nursing Conference, University of Airlangga, and all of the participants joining the conference. As we can see on the screen, I will present the research held by me and my team entitled The Risk Factors of Schistosomiasis in Napu Highland Poso, Central Sulawesi. I will start with the introduction. Schistosomiasis is an acute and chronic parasitic disease caused by blood flux of schistosoma. In Indonesia, schistosomiasis is found only in the highland of Bada, Napu, and Lindu in central Sulawesi. As reported in 2022, there are 245 schistosomiasis cases in Poso district and 12 cases in Sigi district. So the total cases in Central Sulawesi in 2022 is 257. The study aimed to analyze the risk factors of schistosomiasis in Napu Highland. This was a case control study conducted in Napu Highland in April to June 2022. The population was residents in villages with schistosomiasis. The sample size was 148, consisted of 37 case samples and 111 control samples. The samples were gender matched. The case sample was any resident over 2-year-old tested positive for schistosomiasis infection based on the vehicle survey conducted by the Health Office of Poso District in 2021, while the control sample was the nearest neighbor of the case. For variables and data collection, a questionnaire was administered to collect data on education, knowledge, occupation, latrine use of clean water resources, passing through Onco Melaniahupensis luanduensis or OHL snail focus areas, having activities in rivers or troughs, using personal protection equipment when having activities in a place that allows contact with water, passing through OHL snail focus areas, and raising livestock. The result we obtained from the study, the most prevalent schistosomiasis cases were found in male group, age group of 22 to 60 years, people with education, and farmers. The result obtained from data analysis using the chi-square test with alpha at 5%, education and knowledge were found to be associated with schistosomiasis with p-value 0.0818 and 0.056 respectively, while the other variables were not associated with schistosomiasis. Education and knowledge were risk factor for schistosomiasis, which people with a low level of education were 3.147 times more likely to be infected with schistosomiasis, while those with less knowledge of the disease were 2.233 times more likely to be infected. Let's discuss about the association between education level and schistosomiasis. According to the findings, people with low education are more at risk of being infected with schistosomiasis than people with higher education. Higher education is expected to improve people's ability to understand health messages. It's intended that a better understanding of health issues could raise public awareness or attitudes toward implementing clean and healthy living habits to prevent sickness, notably schistosomiasis. Second, the association between knowledge and schistosomiasis. This research involves knowledge regarding the causes, intermediate animals, habitat, mode of transmission, symptoms, animals that can be infected, and prevention and treatment of schistosomiasis. Community awareness must be regularly increased through programs or activities from many sectors to prevent infection in the community, such as the placement of warning signs in the OHL snail focus area in Dodolo village, as we can see on Figure 1. As a conclusion, Education and knowledge about schistosomiasis are risk factors of schistosomiasis for people in Napu Highland. We suggest that cross-sector collaboration is urgently needed to prevent schistosomiasis in the Napu Highland. Also, health promotion might include teachers, lecturers, researchers, religious leaders, and community leaders to improve people's understanding, attitudes, and behavior about schistosomiasis prevention. We would like to acknowledge the WUASA Health Center team, the enumerator team, and most important, the respondents who consented to their time to make this research possible. Thank you.